Welcome to this video on MRI Mastery. In this video, we will explore key competencies, including analyzing pulse sequences, troubleshooting artifacts, evaluating clinical applications, and applying essential safety and ordering protocols.
Here is the 7-week curriculum overview. We will cover pulse sequences, relaxation practice, scanning trade-offs, and safety. Later, we will look at advanced applications, scanner visits, and conclude with a comprehensive review to consolidate your knowledge.
In Week 1, our focus is on fundamental pulse sequences. You will learn to identify components like RF excitation and gradients, differentiate between sequence classes, and understand the physical basis of clinical image contrast. Let's begin with a quiz. Question 1. What is the primary effect of using a flip angle less than 90 degrees during excitation in MRI? Question 2. Which pulse sequence uses a 90 and 180 degree RF pulse pair to reduce inhomogeneities? Question 3. What does T1 relaxation primarily represent? Question 4. What is the typical clinical outcome of using gadolinium contrast in an MRI scan? Understanding pulse sequences is crucial for mastery. It allows you to control image contrast, manage critical imaging trade-offs like speed and resolution, and proactively handle potential artifacts to ensure high-quality diagnostic images. This diagram breaks down the spin echo sequence, detailing slice selection, phase and frequency encoding, and the use of a 180-degree refocusing pulse. We categorize MRI sequences into two main types: spin echo, utilizing 90 and 180-degree pulses, and gradient echo, which uses flip angles less than 90 degrees without a 180-degree pulse. For spin echo sequences, contrast is determined by TR and TE settings. Short TR and TE values result in T1 weighting, while longer values move toward T2 weighting or proton density. Can you identify this sequence? Note the absence of a 180-degree refocusing pulse, which signifies it is not a traditional spin echo sequence. Gradient echo sequences offer faster scanning and lower specific absorption rates. However, because they lack the 180-degree refocusing pulse, they are more sensitive to susceptibility artifacts. Returning to our first question, what is the primary effect of using a flip angle less than 90 degrees? The correct answer is C. By not fully depleting longitudinal magnetization, the sequence allows for faster recovery times and accelerated scanning. Let's continue our exploration of GRE, or gradient echo sequences. When we don't have a 180-degree pulse, we use a bipolar readout gradient to create an echo. This is known as a field echo. While GRE sequences are fast and have low SAR, they can suffer from lower signal-to-noise ratios and increased susceptibility artifacts compared to spin echo sequences. Because the repetition time is often shorter than tissue relaxation times, we must manage residual transverse magnetization. This is done through either spoiling or refocusing techniques. Spoiled GRE techniques actively remove residual transverse magnetization, resulting in images that are primarily T1 weighted. Conversely, refocus sequences preserve it for T2 weighting. A key example of a refocused sequence is steady-state free precession, or SSFP, commonly used in cardiac imaging for its fast acquisition and high signal-to-noise ratio. Let's shift gears to a deductive learning scene. Here we look at a diagram representing a pulse sequence timeline, from the RF excitation to the acquisition phase. Just as the blind men in the story only saw parts of the elephant, we must view pulse sequence components individually to understand how they form the whole image. Why learn these sequences? By understanding the elephant, our diverse pulse sequences, you can better choose the right tool for specific diagnostic tasks. Let's define our terminology. Key elements include the radio frequency pulse, slice, frequency, and phase gradients, alongside repetition and echo times. The RF pulse tips the net magnetization, while gradients provide the spatial localization necessary to know exactly where in the body the signal is originating. When we analyze the RF transmitter, its primary job is to flip the spins into the transverse plane. Without this step, we cannot generate a signal to measure. And during that RF application, a slice select gradient is essential to ensure we are only exciting the specific anatomical plane we wish to image. Here we visualize tipping bulk magnetization in a rotating reference frame. This helps simplify the complex physics of spin behavior during excitation. By applying an RF pulse, we move the bulk magnetization vector from the longitudinal z-axis toward the transverse plane, effectively tipping the spins. Whether the tip is 90 degrees or a smaller flip angle, this rotation is the foundation of all MRI signal generation. Master this, and you master the sequence. Let's review the fundamental components of any pulse sequence. First is slice selection, then the receiver and frequency encoding, and finally, phase encoding, which often appears as a repeating ladder pattern in your diagrams. Beyond basic spin echo, we must recognize three other key patterns. These include fast spin echo, echoplanar imaging, and their distinct variations, which are essential for diagnostic speed and image quality. Coming back to our elephant analogy, remember that each part of an MRI sequence provides a different perspective on the tissue, just as the blind men perceive the elephant differently based on the part they touched. This table maps those analogies. The body corresponds to RF transmission, the tusk to slice selection, the tail to data acquisition, the ear to frequency encoding, and the leg to phase encoding. Now, let's test your knowledge. Which pulse sequence uses a 90 and 180 degree RF pulse pair to reduce field inhomogeneities? Choose from the options provided on screen. We can now examine three more types of pulse sequences, labeling them A, B, and C, to better identify how they differ in their structure and timing diagrams. Focusing on the spin echo, note the defining 90 and 180 degree pulse pair. This configuration is the hallmark of traditional spin echo imaging. The primary purpose of this spin echo sequence is to reduce inhomogeneities, allowing for cleaner images. Here, we see the relationship between these pulse structures. Can you identify the spin echo sequence among these choices? Look for the characteristic pulse pairing that sets it apart. Understanding these pulse sequences helps you avoid diagnostic pitfalls. By knowing how each works, you can better manage image contrast and scan duration. Why is fast spin echo, or FSE, faster? It collects multiple lines of K-space within a single repetition time by applying several 180-degree pulses. Fast spin echo is similar to a traditional spin echo, but is optimized for speed, utilizing multiple 180-degree refocusing pulses for rapid acquisition. Finally, we aim to crack the core of these complex imaging methods. Review this diagram to solidify your understanding of these advanced pulse sequence architectures. Fast spin echo works by applying a train of multiple 180-degree refocusing pulses. This allows the system to fill several lines of K-space within a single repetition time, drastically reducing total scan duration. By mastering these fundamental sequence designs, you will be well equipped to optimize clinical protocols, manage imaging speed, and improve overall diagnostic quality in your MRI practice.